Chris has an incomplete spinal cord injury at this time. So initially he had a complete injury, and a few weeks after that converted to incomplete injury. Initially just sensory incomplete, and subsequently over the last several months he's been gradually recovering strength such that now he has what we would consider an AISD type injury, one of the more functional levels of an incomplete spinal cord injury. Chris's recovery, as we would expect, has been slowing. He and his family were really looking for suggestions regarding the next set of options for them. So he's participated in an enormous amount of therapy. He's incredibly hardworking. We explored a number of options for him. The one that was most appealing to him that he wanted to pursue first was the utilization of a medicine called Ampyra that was tested several years ago in patients with incomplete spinal cord injury, but those clinical trials didn't demonstrate a clear benefit in incomplete spinal cord injury. Subsequent clinical trials in multiple sclerosis showed a clear benefit in regard to walking, which is Chris's biggest goal, is to be able to walk independently. The primary outcome we're hoping for is clear functional progress with a greater degree of independence. It also may reduce some of his spasticity and so allow us to make changes or reduce other medications or perhaps simply improve his spasticity control. It's very fortunate that Chris has had the opportunity to spend some time in the motion analysis lab, and we've collected data before and after he started the Ampyra. We might notice that his kinetics or kinematics of his gait pattern improve or normalize, perhaps either because of the effect of the Ampyra on nerve conduction across the area of his spinal cord injury, or perhaps because of other effects on spasticity and motor control. His gait speed might improve, the motion of individual joints or segments might improve, his control of his center of gravity while walking. All of those things might change, and we might see that on that gait analysis. Certainly if Chris could stand and balance and walk with less assistance, or perhaps could walk farther with the same amount of assistance, both of those would also be clear benefits that we'd be looking for.